Have a prospective patient with us, and we're going to talk about the pluses and minuses to breast augmentation and saline, silicone, textured, anatomic, round, all the questions that I generally get associated with a breast augmentation on a regular basis. So we thought we would film it so that you guys can have any of your questions answered anytime that you want. So I always ask the first question: if you're on a beach in a bikini around people you don't know, do you want them to look at your chest and go, those are probably fake? Do you want them to look at your chest and go, there's no way those are fake, they're not big enough? Or do you want them to look at your chest and go, I don't know, that maybe they are? I can't quite tell.
Ambiguity is fine with me.
Okay, and that's what I would say most people answer it. They don't want to have really fake, really big breasts that are disproportionate to their frame, right? They don't want to have nothing, because there's a reason why they're getting it done, right? So they want that naturally gifted sort of appearance where you kind of would look at them and say, I'm not really sure if those are real or not real. Does that make sense?
Yeah.
Okay. What cup size do you think that you want to be?
Probably like on the verge of BC, but a full B. I actually don't know what size I am now.
Okay.
So a cup size bigger than whatever it is. I'm
Okay.
assuming an A.
So in general, most women, according to Oprah, right, they wear the wrong size bra. They wear a bra that is too small generally, and they usually get the band number wrong. So to get a bra size, you measure underneath the breast. Whatever that circumference is, you add 4 if it's an even number and 5 if it's an odd number. So if you measure at 32, then you're a 36. And if you measure at 40, then you're a 44. Most people forget to add that number, and so they measure at a 36, so then they go and get a 36 bra, and what happens is it's too small for them. The cup is too narrow for their chest. But most women, since they wear the wrong size bra, and they wear one that's too small, they generally, when we talk about cup sizes, there's no way you want to be a B or a C. And I'm going to say that in the sense that when I start showing you pictures and you're saying what type of implants you like and like what size you want, you'll probably end up in that D range, believe it or not. And every woman who has a breast implant is a much larger cup size than you would guess that she is just by looking at her. You would look at her and be like, yeah, something like that, like a C. I'm like, those are triple Ds. Like, what? No, I don't want to be a triple D. I'm like, well, you want to look like this? Yes. Okay, that's what cup size that is. I don't guarantee cup sizes because it's a flawed system, and I don't care what cup size you want to be. Instead, we're going to have you try on implants today, and you're like, yeah, something like this, about this size, whatever this is. And whatever that is what we're going to do, right? And who cares what the cup size is? Make
Sounds
sense?
great.
Okay. So in general, when it comes to implants, there's a saline breast implant. So a saline breast implant is pretty much a bag of water. It looks like a bag of water, it feels like a bag of water, and it can get really deep ripples inside of the implant. The advantage of a saline breast implant is that if it pops, it's just saline, so your body reabsorbs it, but the funny feeling and the rippling that occurs with them, most women do not choose a saline breast implant as their implant today. But it's important that we understand that back in the late 80s to early 90s, saline breast implants were all we had, because in 1991 the FDA took silicone breast implants off the market in the United States. And they were trying to test to see, are they associated with autoimmune disorders, which was the accusation at the time. So from 1991 until 2006, for those 14 years or so, they studied the breast implants and they found there is no difference in the rate of autoimmune disorders between women with or without breast implants. If there was, then we would say, okay, maybe this is causing some of these autoimmune disorders. Now, there's still a large group of women out there that believe that their breast implants are poisoning them. And the name of that disease is BII, or breast implant illness. There's a huge following out there. If you Google it, you'll find lots of people who believe in it. But we don't have any scientific evidence that it exists. There's anecdotal, where the person says, I got my implants out and I feel much better, but it's been accused of everything from, rheumatoid arthritis to gout to you name a disease, and somebody thinks their implant caused it. Does that make sense?
Mm-hmm.
So what I say is, look, if you think your implants are hurting you, fine, let's take them out. I don't care, I'll take them out. But I don't have any scientific proof that that's the case. Does that make sense?
Sure.
Okay. So for a long time, this is all we had. And so what you're going to find, especially if you Google breast augmentation, you're going to find that the majority of American surgeons place a smooth round implant underneath the muscle Okay, it's probably what your friends have had done, what you've Googled or seen pictures of or whatever. Because when all you have is a lumpy mattress of a saline implant, then you want to hide it from the outside world as much as possible. So when silicone implants came along back into the United States market, you have an entire generation of surgeons that's all they've ever done is a smooth, round saline implant. And so they continue to take silicone and use them in the same manner. Well, the problem with having a smooth implant in you, one of the problems, is that, and especially if it's underneath the muscle, is the muscle wants to push that implant down and out and down and out and down and out. And over time, the implant can migrate down on the chest and you can get what's called implant malpositioning. So friends who might have a breast augmentation, have them lay down and their implants oftentimes will fall into their armpits because the pocket's been stretched out by this smooth round implant that's under the muscle constantly being moved around. So placing the implant underneath the muscle is good in that you have thicker coverage over top of it. And so if you have very little breast tissue to cover it, even with a silicone implant, you might still see the rippling through your skin. And so, but when you go to more advanced implants that hold their shape a lot better, you don't need as thick of a covering over top of the implant in order to hide that rippling. Does that make sense? So I don't necessarily need to go underneath the muscle with the newer generation of silicone implants because they don't ripple as much as a saline does. Your breast is not currently underneath your muscle. Your breast is currently on top of your muscle. So it doesn't make a ton of sense to me to put something to make your breast bigger underneath the muscle. I generally like to do that if we have to do it, meaning the coverage is so thin that even with this type of implant, we still are going to need to go underneath the muscle. Because that's not where your breast belongs. So by going on top of your muscle, you will have less pain associated with the procedure, a faster recovery associated with it, and you'll have less animation deformity. So when you release the muscle normally fires and it's connected to your rib cage. So when it fires, it doesn't move your rib cage, but you have to release that to get the implant to sit where you want it to sit. And then when the muscle fires, you get this weird crease in your breast. Yeah. Again, friends that you might have that have a breast augmentation, have them put their hands on their hip and push in, and you'll see their breast go. So that animation deformity is something that we just accept with submuscular implants. We say, yep, you're gonna have an animation deformity. Sometimes it's bad, sometimes it's good. It's all about your anatomy and where your muscle stops and where your breast starts, on how severe it is or isn't. But I don't like animation deformities, and I don't like to mess with your muscle if we don't have to. That's my personal bias. If you go to other parts of the world where the implants were never taken off the market, one of the most common forms of implants used is one of these. This is a textured anatomic implant. It gives a more natural breast shape, but the texturing on it helps to protect against capsular contracture. Capsular contracture is something that can happen to any implant. Your body recognizes this as a foreign object, and it starts to make it hard because it's trying to squeeze it out of your body. So it's something we don't want to see with any implant. Texturing the implant decreases that by about half. Okay? Putting it under the muscle decreases it by about half. So a lot of people put their implants under the muscle, they accept the animation deformity because they want less capsular contracture. By texturing it and going on top of the muscle, you decrease your risk of capsular contracture compared to a smooth one on top of the muscle, and you decrease your risk of implant malpositioning. The texturing basically prevents the implant from turning very easily. Now, if the texturing is the greatest thing since sliced bread, why doesn't everybody use texturing? Well, there's recently been a discovery of a disease associated, we think, with the texturing of an implant. That disease is called ALCL. It's a form of lymphoma that occurs around the implant. It currently occurs with Sientra's implants, which is the texturing that I use, about 1 in 70,000 times. That's the same risk of you dying every time you get in the car. So today when you drove here, you took a 1 in 70,000 chance that you were gonna die in your car, yet you soldiered on and you took that chance. So for some people though, a 1 in anything chance at having this rare form of lymphoma is too much, and therefore they don't want to ever use texturing. But in reality, it's such a low risk for these types of implants that the benefits that come along with them might outweigh the risks that you're willing to take associated with it. So to summarize, smooth implants are no risk of ALCL, but they have a higher risk of capsular contracture and a higher risk of implant malposition. Implant malposition occurs in about 5% of implants, and capsular contracture occurs in about 9% of implants. half the risk of capsular contracture and very low risk of implant malposition. So the more common things you're saving yourself on, but you're taking the 1 in 70,000 risk. Does that make sense?
Mm-hmm.
The other one comes down to shape. So if we think of a naked breast, right? So a naked breast should be a slow transition to the point of the breast, not a chest, breast, like a little beer can shelf, okay? In America, because almost everyone gets a smooth round implant in the United States, the shift is occurring in women's minds about what is a normal breast shape to where it looks like they have a very round, very full breast, even when they're naked. I'm gonna show you pictures of women. I have one lady in particular who has the same exact volume implant with this type and with this type. So you can see in the same person how the breast shape changes to help you decide, do I like a more natural breast shape or do I like a less natural breast shape? And there's no right or wrong answer. We just want to help you figure out which one is the right one for you. When it comes to placing implants, we usually put them in from an incision underneath your breast, in the fold where your breast tissue folds over. You might be like, well, you know what, my breasts are not large enough to even have a fold. We figure out where that fold needs to be. And then when you're looking at the person straight ahead, you want to see the scar because it's in that shadow underneath the breast, if that makes sense.
Mm-hmm.
The other normal ways that we put in implants are through the nipple or through the armpit. Both of those have a higher risk of capsular contracture because you're going to drag the foreign object through the breast itself, and the breast has bacteria in it. And so if the bacteria gets on the implant, you increase the risk of capsular contracture. So the least complicated way of putting it in is to go underneath your breast. The least way that we're going to mess with your nerves or disrupt anything is from underneath your breast. And you're 26, so in the future, if you ever need to have them replaced, we generally do it from an incision underneath your breast. So you're really not sparing yourself anything by going through the armpit or going through the nipple as far as scars for the future, because most likely you'll have had your implant replaced or exchanged or removed or whatever at some point further on in your life.
All right.
Understand that you're interested in potentially having children in the future?
Yes.
And so that's a total crapshoot. So some women, they get pregnant and have kids and afterwards their breasts are bigger. Some women, their breasts are smaller, but we don't know what's gonna happen with your breasts. So in general, we prefer to do breast augmentations in women who are not gonna have kids or have already had their kids and are done with it. We definitely do it on women who have not had kids and might wanna have kids in the future, and that's totally fine, but it's a crapshoot. Like, I can't make any guarantees afterwards. Definitely wanna err on the smaller side of your implant because you wanna leave as much stretch left in your breast as possible, because even if you don't breastfeed, your breasts are going to get much larger during pregnancy or after pregnancy, and if you've already used up all of your stretch, then you might get more stretch marks or you might have a more deformation to your breast following the pregnancy.
Right.
So definitely be on the smaller side of that if possible when you're considering your sizes. Now in general, when we start trying on sizes, you're going to have a hard time telling the difference for anything that's less than 50 cc's difference between the two sides. So we have 50 cc sizers where it's like, okay, here's a 200, here's a 250, a 300, 350, blah, blah, blah. We just want to find the ballpark that you're comfortable in. You don't need to call the office 3 weeks from now, right before your surgery, and say, oh, I was gonna go with a 385, I want the 390. You won't even be able to tell the difference. So if you're gonna change your size, be at least 50 cc's different. And totally fine to call the office and be like, no, I want the 450 instead of the 375. That would actually be about a third to a half of a cup size difference.
All right.
Makes sense so far?
Yeah.
It's a lot of information. So, okay. So I think at this point, we should show you different pictures so you can decide what type of breast shape that you like. We've talked about saline, we've talked about silicone. A couple other things to talk about, sorry. If I were to take a knife right now and cut this implant in half, it would be like cutting Jell-O. So you would be able to take both halves of the implant and look at them and nothing would come out of it because it's like a gummy bear, and that's why they call it gummy bear implants. All the implants we use these days that are silicone are gummy bear implants. So if there was a leak, God forbid, it wouldn't have anywhere to go, right? It just kind of sits there. You would still, if you were to touch the inside of this, if I were to cut it, it would get like tacky on your hand, kind of like if you touch Jell-O, there would be like a residue on your finger. That residue gets on the outside of the implant and your body doesn't like it. So it forms capsular contracture around it. That's how you would know your implant is leaking, is capsular contracture. The FDA said when we brought implants back in the market in the United States, they said, okay, you should tell them they're supposed to get an MRI every 2 to 3 years to look for a silent rupture. Now that recommendation doesn't really make a ton of sense to me. I've told it, that's what they're saying, the FDA. It doesn't make a ton of sense to me because they spent 14 years and millions of dollars studying the implants to prove there's no disease associated with them. So why are we getting an MRI to look for a silent rupture, right? Either it's ruptured and they're having a problem with it, in which case we should go and fix it, or it's fine and they're fine. But that's their recommendation. The problem is the MRI costs about $3,000 and your insurance company will not cover it because it was from a cosmetic thing that you had done. So the implant company doesn't want to pay for it, the insurance company doesn't want to pay for it, you don't want to pay for it, I don't want to pay for it. So what ends up happening is most patients, even though the FDA recommends it, they're not going to come repo your breasts if you don't get it done. Give them back. So, but that is their recommendation. The average implant has been replaced 10 years after it was put in. A lot of people are like, wow, they only last 10 years? No, it's not a gallon of milk. There's no expiration time. It's that, does that person have to have it fixed? Well, yeah, I would say so, right? They're pretty lopsided and asymmetric. Well, what about like this person? Well, I don't know, they're a little off, but it's not terrible. So everybody wants to know which ones had to have it fixed. And my question back to them is, does this person have to have it fixed? Well, what about this person? What about this person? So that 50% includes any reason why you took your implant out and replaced it, or just took it out or whatever. Maybe you got breast cancer. Maybe you got shot in the chest. Maybe they remind you of your ex-husband. Maybe, you know, any reason you want. Maybe you wanted to be bigger. Maybe you wanted to be smaller. Maybe you had BII and you thought they were harming your body. Any reason, 50% have been replaced or removed 10 years after they were put in. So that's why I said at 26, you're probably going to have another surgery at some point in the future. Having said that, don't just call at 10 years and say it's time to replace my implants. If you're not having a problem, they can go your entire lifetime and not have a problem. The rupture rate of an implant is 1% per year of implantation. So if they've been in 10 years, you about have a 10% chance that it's ruptured. The infection rate is 0.5% per year. So those are two kind of have to do something about it. It's infected or it's ruptured. All the other ones are just kind of desire for size change. In your case, what if you get pregnant in 3 or 4 years and your breasts look all wonky afterwards and you want it fixed, and while we're there, we're going to replace the implant, you know, you would fall into that category.
Right.
Okay? So, walking into here, a lot of people have preconceived notions about what they want. I want a 350cc implant, I want it to be smooth, round, high profile, I want it under the muscle. And other people walk in, I don't know, I just want bigger breasts. Do you have a preconceived notion about what you want?
Well, I have a friend who has had her breasts augmented, and she told me that there's a minimum fill to even be able to do it. And
Yep.
so her recommendation to me was try to go as small as possible, and you mentioned that that's better if you plan on having children anyway. So erring on the smaller side, and also I'm very active, so a lot of muscle growth and then, you know, like growth and then whatever opposite of growth is, and I ride horses, and so there's a lot of movement. So taking that into account, those are my 2 considerations.
Yeah, absolutely. So your girlfriend is correct in that there is kind of a minimum. So what we do is we measure how wide is your rib cage, how wide is the foot plate of your breast. And if you put an implant in that's way too narrow for their chest, so like if I put, especially because of how tall you are, if I put an implant for a 5-foot person, right, into you, that is going to look like a chiclet on you. You're going to be able to fit like 3 of them across your chest. So your breasts will be very wide spaced and just won't look very natural. And so what we'll do is we'll measure how wide and how tall your breast is, and then we'll find an implant that is wider to fit your frame better. Then once we've picked the width of your chest, or your body, measured it, I should say, and measured the thickness of your breast, we then say, okay, here are the implants that are that wide. There's this one, this one, this one, this one, and this one, and then you get to pick that volume as you go from there, if that makes sense.
Mm-hmm.
So, I want to thank everyone for listening to this. We're going to go to a more individual discussion now on her body, but hopefully that generic discussion of breast implants is helpful for people in trying to decide what size implants they want to have or what type of implants. Thanks.